I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're turning our attention to a new report from the State Office of Cannabis Management, which convened nearly 24 listening sessions around the state where they solicited feedback from more than 300 young people on what they know about marijuana and what they want to know. For more on the findings, we're joined in the Capitol Press Room by Dr. June Chin, Chief Medical Officer for the State Office of Cannabis Management. Welcome back to the show, Doctor.
Thanks so much, David.
So a recurring theme of these discussions last year with young people was mental health. And in the context of cannabis, you heard from the minors that it could potentially, quote, take the edge off and generally help deal with the pressures of everyday life. Conversely, though, some kids were worried that marijuana could make existing mental health problems worse. What would be your message to kids on the intersection of mental health and marijuana? I mean, what is the difference between fact and fiction when it comes to these types of issues?
Well, I would just, say that it's the finding that we keep coming back to, and it reframes the whole conversation. When, according to our report and our listen and learn sessions, when 85% of the sessions with young people surface mental health in the same breath, unprompted, before we asked, before we framed it, they're not talking about cannabis in the abstract. They're telling us what hurts. And when I look at the clinical literature, it makes it clear that when young people reach for a substance, right? When we look at the research and young people reach for a substance, they're almost always trying to solve an emotional problem, right? So the question worth asking isn't why the use, it's why the pain. When young people connect to cannabis to stress, cannabis to anxiety, cannabis to coping, cannabis to sleep or social pressure, they're answering that question for us. And substance is rarely the whole story. It's the pain underneath it that almost always is.
But those issues or those concerns that the young people brought up, I think, are emblematic of the same thoughts that former young people probably have about marijuana. I know myself as a millennial, I have conversations with people who tell me that they use marijuana to take the edge off, that they use it to help them fall asleep at night. And I guess I'm curious, is there a medical backing to this type of thing? Is this something where you would advise someone to use marijuana to take the edge off, or would you say consult a doctor if you're going to try to use this in a medicinal capacity?
Well, the American Academy of Pediatrics, and I subscribe to this as well, is no use for teens,
Sure.
right?
Well, it's
Your brain
illegal.
is still developing. Yeah, it's illegal, but of course, but your brain is still developing, your frontal cortex, your executive function, and you're still trying to understand and cope with life and how, stress, we all deal with stress. And as youths, we've dealt with stress, but we're also learning how to cope with stress and what is in our toolkit when we're coping with stress. I'll give you an example in one of our lessons and learns, which is really interesting. There was a 16-year-old boy from a small town in North Country, and his dad works in farming and construction, when there is work. And lately there hasn't been much of it. His mom drives 40 minutes to a retail job. So Tyler, we'll call him Tyler, plays junior varsity hockey. He gets good grades. He doesn't cause trouble. So by any external measure, he's fine. This is normal teen stuff. But in our session, he was quiet for a long time, and he said something that stayed with me. He said, I don't really smoke that much, just on weekends, but the only time, my brain actually stops. And so we asked him, what his brain was doing the rest of the time. And he said he was worried about money and graduation and whether his parents were going to be okay and what happens after graduation, because there's not much here in North Country and he feels like he's abandoning them. But these are the things that even the economic anxiety that most adults would struggle to hold, teens are holding that as well. His nearest therapist, that his family goes to, that takes his insurance, is over an hour and a half away, and there's a 3-month wait list. So when we look at these things, we're looking at it from a health equity perspective. And so these are the things that we want to dig into when we talk about cannabis or substance use in teenagers. His mom was also in that session, was in that session, and she said she had noticed a couple of, smell, a couple of odor a few times in the backyard when he would go off alone and, at night. But she didn't know how to bring it up without it turning to a fight. And she said, I don't want him to think that I don't trust him. I just don't know what to say. And these are some of the things that you'll find and you'll uncover in our report. These are two people in the same house. They're both carrying the same weight, but, teenage boy didn't know where to start. Mom didn't know where to start. This is not a kid in crisis, but this is a kid managing the only way that he knows how, and a parent that wanted to reach him in a way, but she didn't have the right words.
For those teenagers or even younger who are using illicit cannabis to essentially deal with the stress of life, to turn their brain off in the case of Tyler, did you get a sense of where they're getting the marijuana from? Obviously, in Tyler's case, it's not from his parents, but I imagine there are some parents who say, I use marijuana this way. I think marijuana is okay, and I'm going to make this available to my kids. I mean, did that seem to be the way that kids were accessing it, or was it more common, like the anecdote you guys have in the report about the brother or a cousin who hooks you up?
Yeah, we did get a lot about the parents providing the cannabis. The parents really wanted to understand the science just as much as the teens did. We explained, that the adolescent brain is still developing. We know that earlier and heavier cannabis exposure does appear to carry greater neurodevelopmental risk, and that's just not a talking point. Again, that's the AAP stands behind that as well. But we also know from the report that fear-based or punitive approaches don't move outcomes, right? What works is honest, age-appropriate education and early intervention. And most especially, and that's why I bring up, this mom and this son, is the quality of the relationship between the young person and the adults in their life. Young people are far less likely to reach for a substance to manage pain when they're already having a relationship where they can express that pain openly. And that's what a sentiment that we got from the report as well.
Did you find any sort of parallels between the way parents have historically dealt with alcohol, which has been historically legal, and marijuana, whether there's that idea of, well, I want them doing it at home or abstinence only? Did that type of discussion come up at all?
Absolutely. And some of our listen and learns included folks that work, in the school district, like teachers and guidance counselors and nurses as well. And some brought up, the good old DARE program, right? There were different opinions as to, what works and what doesn't. But from the teens, from our youth, it was clear that scare tactics didn't work. They wanted to understand the science and really understand, well, how does it affect us neurodevelopmentally? I mean, teens is, now in 2026 is very different than the teens in the 1990s, a lot smarter, a lot sharper. And then the cannabis is very different
Whoa,
as well.
whoa, whoa. I'm a kid of the 90s. I've met some of these Gen Z, Gen Alpha kids. I could take them on. Okay, but I'll take it. Let your point stand.
Okay, David. But also these form factors are different, right? Growing up in the 90s, we didn't have the same form factors, the same sophisticated, the drinks and the vapes and the edibles that it is now.
Hmm.
It's easy to overconsume, and teens are exposed to a lot of this in social media, so they're smarter, they're sharper, and we need to have age appropriate education.
Well, that idea of a different world available to people today, one of the quotes from the report is someone talking about how it's not the same weed that we grew up with. Is that right from a clinical sense? Is the products available in the legal market or even the illicit market, is it demonstrably different than what was available prior to legalization or even going further back?
Yes, the teenager of 2026 is not using the product studied in 1996, right? So we have increased THC potency that has increased dramatically, but I don't want to just harp on potency because the perceived risk among teens has declined. We know that when you look at, just like you said, you're looking at a medical market. Maybe grandpa uses it for arthritis, or mom and dad might be using it for chemo or rheumatoid. So you have this wellness narrative, right? And you have this increased normalization. You have this with legalization. So the perceived risk from teens is also declined. And then there's a pattern worth naming. I would say youth use is going down. When you look at the data, what the data shows, teen cannabis use in New York has been nearly cut in half since 2001, cut in half. And this is 2 decades of data, grades 9 through 12 across the full arc of legalization. So did youth surge, that everyone predicted go up? No, it didn't. That's not just the overall number. Kids are starting later. So when you look at the data, early initiation before the use of age 13 has dropped in half over the past decade alone. So you think about age verification, packaging requirements, licensed retail instead of unregulated markets, right? That infrastructure is doing part of its job. But again, it is complicated because that teen of 2026 not using the same product that we're referring to in 1996. So the education has to be modernized and different.
The young people have grown up in a society here in New York where we've had medicinal marijuana for more than a decade, so essentially for the vast majority, if not all, of their lives. So, did you get any sense of how that impacts their understanding of the medical purposes of marijuana or cannabis more broadly? Did they have maybe more acceptance about medical marijuana or have broader understanding about it than what you might expect for the millennials like myself or older people?
Yes, I think they were definitely a lot sharper. I give you an example. There was a girl in the capital region, a 14-year-old. She said she's never used cannabis, but she knew far more about cannabis than anyone else in the room. She said it wasn't her thing, but she knew who was exactly using it in her school and who wasn't. And she said a different thing an interesting thing that stuck with me. She said the boys use it because they don't want to feel stuff, and the girls use it because they feel too much. And she really got into the mental health aspect of it. So I think when we talk to teens, they're much more in touch and have the language to explain feelings and what's going on in family dynamics versus school versus wellness versus what they see on TikTok. So these are really robust conversations that we were having during the listen and learn sessions.
Do you think as that cohort ages and begins making some of their own personal healthcare decisions, they're going to be more likely to gravitate towards medicinal marijuana as an option and maybe broach conversations with their healthcare providers than, say, the adults of today?
Yes, I do think. I think so. I think when it's more normalized and when clinicians are more inclined to ask, are you using plant-based medicine? Is anyone in the home using medicine? Or talk about safe storage, for example. As those conversations get more normalized, it will be more common in the healthcare encounters.
Is there a next step for you from the medical side of things with this report? Is there any sort of call to action that you feel like you have with this new information?
Absolutely. We stay tuned. We are actually expanding our youth campaign, so you'll be learning much about that in the coming summer months. We also have the Center of Excellence for Cannabis Care and Health Equity. That is Governor Hochul's State of the State initiative that she announced in January. So we are partnering with 7 pilot institutions across the state, including SUNY Upstate, SUNY Stony Brook, University of Albany Public Health, and CUNY Public Health, and University of Rochester, where we are helping educate our clinicians and integrating into grand rounds, med school, as well as residency. So these are all great things to have on a report, but you need to be able to integrate it and implement it in real healthcare instances from pediatrics all the way to geriatrics. And that's what we hope to do.
Well, we've been speaking with Dr. June Chin. She's the Chief Medical Officer for the State Office of Cannabis Management. Dr. Chin, thank you so much for making the time. Really appreciate it.
Thanks, David. Always a pleasure.
Thanks for listening to today's edition of the Capitol Press Room. For an insider take on what's happening in state government, check out our Dispatches from Planet Albany show, available wherever you get podcasts or at capitolpressroom.org.
Join us again for Capitol Press Room, a production of WCNY Connected, Syracuse.